At 8 weeks, I was spotting. I was at work. I was sitting on a stool teaching math at the overhead, and I started spotting really bad. And I had to leave work and go to the OBGYN, and they thought I was having a miscarriage. And at that point, they did an ultrasound and said, not only are you not having a miscarriage, but there's 2 heartbeats. So that's when I found out I was having twins. And then everything went really smoothly. My pregnancy went very smoothly, although at about probably 24 to 28 weeks, because I went to have a level 2 ultrasound because of the twins. It's a high-risk pregnancy. I found out that Katie had large kidneys. They were functioning normally, but they were generous in size, is what they said. And then it was, oh, look how cute she's sticking her tongue out. On every ultrasound, she was sticking her tongue out, but it was, look how cute she's sticking her tongue out. And nobody made the connection. Maybe the perinatologist knew in his mind the connection, but he didn't want to say anything. So we knew she had the big kidneys and that she was sticking her tongue out. And then in about the 32nd to the 34th week, I developed gestational diabetes. I had to have a C-section because of the twins. One was in the right direction and one wasn't. So I did the C-section, and then the nurse came and said, here's your daughter, here's your son, and off they went. And they sewed me up. But just in that 1 second that they said, here's your daughter, I looked at her and I knew something wasn't right. I saw her tongue sticking out, and I don't know, something just told me something's not right. So off they went, and because I had gestational diabetes, they were checking both of the babies for hypoglycemia, and Katie had severe hypoglycemia, so she was in NICU. I was back in the room then, and I was holding Cody, and they brought Katie in, wheeled her in, and I said to the nurse, why is she sticking her tongue out all the time? And the nurse said, she's got a protruding tongue. We were told the family was aware. And I said, well, we're aware that she's got a big tongue, but no one's told us why. And she said, well, you have to wait for the doctor, which I don't think happened until the next day. And we all just kind of saw this little tongue sticking out, like something's not right here. I mean, it was cute at that point, you know. And then the next day, the endocrinologist came in that was treating her for the hypoglycemia. And he told us that it could be one of several things. The large could just be an isolated case of macroglossia. It could be a thyroid problem, or it could be, I remember him saying, buckwheat something syndrome. And so my family was calling, you know, what's going on with Katie? And I said, no, no, they think she might have buckwheat something or other. They said, buckwheat? I said, I don't know. That's what they said. I remember sitting in the hospital room while she was still being treated for RSV, and in walks a doctor, and she introduced herself as an oncologist. And as soon as you hear that word, oncologist, you know you're dealing with cancer. And she told me what they saw on the CT scan, and she told me that they wanted to go in, the surgeon wanted to go in and do a biopsy, but she felt that if they're going to go in, they might as well go in and remove the whole tumor, which is what they did. And then the biopsy in-house at the Children's Hospital here, they thought it was hepatoblastoma, but they also sent it out to Johns Hopkins, Baylor, and another hospital, I can't remember where right now. And they all concurred that it was hepatoblastoma. And we were told that she needed to have 4 rounds of chemotherapy just as a precaution, because we caught it very, very early and it was very, very small. The thing with hepatoblastoma is it's, you know, a tumor in the liver, and there's an enzyme put out by the liver that if there's something going on that's malignant in the liver, this alpha-fetoprotein test picks it up. I think I read somewhere like over 90% of the time the AFP test will pick it up before it shows up on the ultrasound. By the time it's visible on the ultrasound, it's obviously, you know, large enough to be visible, whereas the AFP can pick it up at, you know, really, really tiny, and that's fortunately what we did. And I absolutely believe that blood test saved my daughter's life and made it so that she only had to do 4 rounds of chemo, because that was stage 1. When you go to stage 2, 3, and 4, the rounds of chemo get more, and it's more toxic chemo. As it is, she did lose part of her hearing in her right ear from just the 4 rounds of chemo. Fortunately, her left ear stayed normal, but her right ear, she has a moderate hearing loss from the chemotherapy that she did. And I can only imagine if she had to do more rounds that it would have affected her hearing, you know, even more so. She is now 4 years in remission, thank God. And we had actually had her tongue surgery planned for December 2000, but because the cancer came up, obviously that had to be taken care of first. And then once she got done with her chemo in April and her oncologist gave her the all clear, we went to Dr. Marsh in June of 2001, and she had her tongue surgery then. And miraculously after that, everything just got exponentially better. Her blood sugar problems went away. She did have high blood pressure, but that went away. Obviously, she wasn't on any more chemo. From her tongue surgery on, she has not been on any medications. And at one point, in the first few months she was born, she was probably taking 8 different medications a day. But since she was 13 months old, she's been on no meds at all and has been totally healthy. So now our only issue is the hemihypertrophy. Her right side's bigger than her left, and we go to an orthopedist for that, and she may need a shoe lift eventually. But as you can see, she's a very happy, healthy, very bright, normal little girl. So the first year was rough, but here we are.